Hello again, and welcome to part 2 of our first lecture on an introduction to the human body. And in this lecture, we're going to learn mainly about something called anatomical position, or anatomical positioning, or standard anatomical positions. When we are describing the body, when one person who's doing anatomy is describing a body part to another person who's doing anatomy, you should be able to use some words that tell the other person whether that body part is above or below another body part, or to the left or right, or to the closer to the center of the body or farther away from the center of the body relative to some other body part. And so in order to do that, we need to learn the terminology that is used to indicate these directions. Okay, so that's the main purpose of this lecture. And a lot of the first lab, there will be a big quiz in the first lab in the second week of the course where we do a lot of work regarding that. You'll be doing an exercise that you get credit for, and it will basically require that you understand how to describe where one body part is relative to another in an anatomical sense. All right, so these are the topics for this lecture. We did the first bunch in the previous lecture. Now we're going to do the last two. Standard anatomical position. Okay, now you see that on the left of this figure, there's a woman facing us. And when we describe anatomical position, when we're describing the location of any body part, we assume that the person that we're talking about is standing in standard anatomical position, which is the position that you see the woman in on the right. Now, she's facing us, which means that her left hand will be on our right hand side. Right? So this is her left hand, which is on our right. But we don't care about our right. We only care about her left and her right. Right? So this is anatomical left, and this is anatomical right. Okay, so now we've established left and right. Now this is the image on the right hand side of our screen is a frontal image, right? So we're looking at this woman from the front. If we look at her from the side, it is referred to as a lateral view. So on the right we have a frontal view, on the left we have a lateral view. Right? And if you look at the diagram on the left, you'll notice that the front of the body is referred to as the anterior, and the back side of the body is referred to as the posterior. Right, so we've already described anatomical left and anatomical right. We are always talking about her left and her right. And we've now described the anterior and posterior sides of the body. Right, so for example, the heart is located in the anterior part of the body. It's a little bit embedded inside, but it is anterior relative to the spinal cord, which is located in the posterior part of the body. Right. Now, so anterior means the front side of the body. Posterior means the back side of the body. Now, when you're describing body parts of a person who's in anatomical position, we describe the position of the body parts assuming that the person we're talking about is in anatomical position. So notice that this woman on the right has her hands with the palms facing us and the thumb pointing outward. Right? So the thumb is not pointing inward, the thumb is pointing outward so that we can see the palms. Right? And her feet are pointing towards us. Right? That will become the fact that the hands have the palms facing forward, which leads to the thumb being pointed out. Right? The thumbs are pointed away from the body, not towards the body. That's critical to understanding anatomical position. All right, now, so we've learned about the anterior side of the body and the posterior side of the body. Now, unfortunately, when we're describing humans, a lot of people study the anatomy of animals as well. And the main difference between humans and animals is that animals walk on all 4 limbs, whereas humans only walk on 2 limbs. Humans walk on their legs, whereas animals have 4 legs, humans have 2 legs. humans have 2 legs and 2 arms. So humans stand upright. If you're dealing with animals that walk on all fours, it's a little bit more complicated. And in that case, you would refer to the back side, the posterior side of the animal, as the dorsal side. And you would refer to the belly of the animal, the belly side, as the ventral side. So that is usually, those terms are usually used to describe animals, but they can also be used, they are occasionally used to describe humans as well. So the posterior side of the human body is also referred to as the dorsal side many times. So the posterior or the dorsal side of the body versus the anterior or the ventral side of the body. Okay, now if I haven't made this diagram too crowded, I'll draw in another color here. Notice that we have the foot down here, right? And we have the trunk of the body up here. So this is referred to as the trunk of the body, the main part. And so take a look at the foot and the knee. Okay? If one part of the body is closer to the trunk than the other, we say that it is proximal to the other body part. So in this case, we would say that the knee is proximal to the foot because the knee is closer to the trunk than the foot. Okay, and then we would also say that the foot is distal to the knee because the foot is farther away from the trunk than the knee. Do you see how that works? Distal and proximal are 2 relative terms that we use to describe how close a body part is to the main trunk of the body. So in this case, it's a relative term, so we would say that the knee is proximal to the foot because the foot is farther away from the trunk than the knee, and we would say that the foot is distal to the knee because the foot is farther away than the knee. Right? So that is what the terms proximal and distal refer to. We're usually talking about things, body parts that are on the arms or the legs, not the trunk itself. Okay, so based on that terminology that I just said to you, how would you describe the position of the hand relative to the elbow? Okay, the hand is actually distal to the elbow because it's farther from the trunk than the elbow. All right, how would you describe the position of the elbow relative to the shoulder? The elbow is actually distal to the shoulder. You could also say that the elbow is distal to the shoulder but proximal to the hand. The elbow is distal to the shoulder but proximal to the hand because the elbow is actually closer to the torso than the hand. Okay, so that is distal and proximal. Distal and proximal are a little bit hard to understand, but once you use those terms quite often, you'll understand what they mean. All right, one more thing that we have to worry about here. If you draw a line down the center of the body, anything that is farther away from the center, we refer to as being lateral to another body part. Right, so notice that the thumb is farther away from the center of the body than the small finger. So we say that the thumb is lateral to the small finger. Again, this is a relative expression. All right, now what about things that are closer to the center of the body? We refer to them as being medial to another body part. So if the thumb is lateral to the little finger, you can also say that the little finger is medial to the thumb. Right? So that's another way of describing it. Right? So medial and lateral are two other terms that are a little bit difficult to understand, but once you use them, they'll be fine. Okay, and normally if something is located above something else, the thing that is located above is referred to as superior, and the thing that is located below is referred to as inferior. So while we've discussed the elbow and the hand and the shoulder in terms of proximity to the torso, proximal and distal, you could also describe them as being superior and inferior. So for example, the shoulder is superior to the elbow, and the hand is inferior to the shoulder and inferior to the elbow. Right. Now, so inferior and superior and inferior simply means above or below another body part. There are two other terms that are not as commonly used as superior and inferior. The two other terms are referred to as cranial and caudal. So if something is located above something else, we say it's located cranially. The word cranial means the head, so it refers to the head, as does the word cephalus. So cephalic refers to the head. Cranial also refers to the cranium, which is the skull, basically. Right. So when something is closer to the skull than to somewhere else, then you can say that it's located cranial to this. But that term is not used very often. And then if something is located inferior to something else, you can say it's located caudal to that. So, as I said, the term anterior and posterior are easily used with human anatomy. If you're talking about animals that walk on all fours, the terms dorsal and ventral are used more commonly, because then we refer to the front part of the animal as the anterior and the back part of the animal as the posterior. Whereas in humans that stand upright, it's a little bit easier because the dorsal side is the same as the posterior side, and the ventral side is the same as the anterior side, because humans have only a front and the back because we stand upright when we're in anatomical position. But animals that walk on all fours, we have to distinguish between the back and the belly versus the head area versus the backside. So that's why with animals we use dorsal and ventral as well as anterior and posterior. You have to use all four terms when you're talking about animal anatomy. And there are lots of courses that teach you about comparative anatomy where we discuss animals a lot, but we don't actually teach that at Columbia, but other universities do, and generally in third or fourth year they teach that. Okay, so with animals, we have to use all four terms. With humans, we just have to, with humans, dorsal means the same thing as posterior, and anterior means the same thing as ventral. All right, you've seen a shark. What do you call that fin that's on the shark's back? Right, if we're talking about animal anatomy, that is referred to as the dorsal fin. And these fins that are on the front, on the belly side of the shark, are referred to as ventral fins. But with a human, we only have to worry about posterior being the same as dorsal and anterior being the same as ventral. And then above is referred to as superior, below is referred to as inferior. For example, the nose is superior to the heart. The heart, therefore, is inferior to the nose. Okay, so just to once again reiterate that when we talk about anatomical right, we're talking about her right, not our right. We're not talking about the right-hand side of the page. We're talking about her right. This figure that is, this woman that is standing in front of us in anatomical position. When we refer to anatomical right, we are referring to her right. And when we refer to left, we're referring to her left, not ours. Right? So this is her left foot and her right hand. Okay, so of course cranial and caudal mean up and down, mean superior and inferior respectively. Proximal and distal is generally referring to the arms and legs and parts of the arms and legs and how close they are to the torso. And then medial and lateral. Lateral means farther away from the center, and medial means closer to the center of the body. This is the center, actually. Now here's another term that we have to become familiar with. Superficial versus deep. Superficial means on the surface. Superficial means on the surface. So here we have some muscles. We're going to learn all about these muscles. These muscles that are located near the surface of your chest are called the pectoralis major muscles, and they are classified as superficial muscles because they're near the surface. Underneath, we have another set of muscles located underneath the pectoralis major that are referred to as the pectoralis minor. And the only way that you can actually see those muscles is to cut away the pectoralis major. So you have to dissect and get underneath the pectoralis major to see the pectoralis minor. And so they are referred to as deep muscles. Deep muscles. So be aware of the terms superficial versus deep. We'll talk a lot in this course about superficial blood vessels. So when you take a blood sample, you usually take a blood sample from a vein called the median cubital vein. The reason why you take a blood sample from that vein is because it is a superficial vein. It's very close to the skin. It's very, very close to the surface. So you don't have to poke the needle very deep in order to get at it. There is another vein that's much deeper called the brachial vein, which you would have to poke a needle through a lot of muscle to get at the brachial vein, so that would be painful, so there's no point in doing that when you can take blood from a superficial vein. You can take blood from a vein that's close to the surface. All right, now many times in anatomy we do a virtual dissection of a person to see what's inside. Right, so you imagine that you're cutting the person in half and then moving the two halves apart so you can see what's inside. And when you cut somebody in half like that, you have dissected. The word dissect actually means to cut in two. Literally, it means to cut in two in Latin, to dissect. And if you cut somebody in two, you have sliced the whole body down the middle or something, and you've cut them according to a plane. Right, so a plane is as if you took a big piece of glass and you used it to slice a person in half. Terrible thing to think about, but that's not really what we're doing. We're just pretending to slice them in half. And so we have to know about the different planes. Planes are imaginary slices through the body. All right, now look here. If you slice, notice that the body has a long axis. That's the tall part when you stand up. And the body has a short axis, which is going this way. Now, if you cut the body straight through according to the short axis, that is referred to as a transverse plane. Right? If you cut the body anywhere through the short axis, this diagram is showing the body cut right through the middle, right through the abdomen, but it doesn't have to be. You could cut it through the neck, for instance, and that would still be called a transverse plane. It would just be called a transverse plane through the neck instead of through the abdomen. Okay, now here's another plane. Notice that we cut the body down the long axis, but we do it from shoulder to shoulder. Right, so it's as if you took a knife and you pointed it from shoulder to shoulder and you cut downwards. That is referred to as a frontal plane. Right, so you're cutting the body downward, down the long axis from side to side. That's referred to as a frontal plane. And I very often ask you to tell me the difference between a transverse plane and a frontal plane on exams, or I show you a picture and I say which one of these is the frontal plane and which one of these is the transverse plane. So you do need to know that, right? So if you cut the body down the long axis from shoulder to shoulder, that's referred to as a frontal plane. Now, if you take your imaginary knife and you cut the body right down the middle, not from shoulder to shoulder, but straight down the middle, like this, it is called a sagittal plane or a sagittal cut. Right? Now, if the cut is right down the very center of the body, as is shown here, that's referred to as a mid-sagittal plane, a mid-sagittal plane. But you can also cut the body from front to back in other parts, and we call those sagittal planes as well. They're just not mid-sagittal planes because they're not running down the middle of the body. Okay, one final term, a coronal section. Right? You see the term coronal up here? The word coronal is the Latin word, the word corona is the Latin word meaning a crown. Now imagine putting a crown, which is a round headdress, a round piece of jewelry for the head. You put a crown on somebody's head and then imagine that crown cut right through the person's head instead of sitting on top of their head. That would create something called a coronal section. Basically, a coronal plane or a coronal section is where you cut an object that is round or elliptical in shape. You do a frontal cut, a frontal plane cut through a round object. So if you do a frontal plane cut through the skull, that is sometimes referred to as a coronal section or a coronal plane because you've cut through a round object, which is the head. Occasionally you hear people referring to cuts, imaginary cuts through the heart as a coronal section as well. So basically anytime that you're cutting through a round or an oval shaped object and making an imaginary plane, but it's a frontal cut, you refer to that as a coronal section. Okay, here's some other examples. This is looking at the body from the top down. Cutting from shoulder to shoulder is a frontal plane, right? You can see it here as well. And then cutting from front to back is referred to as a sagittal plane. And if it's directly down the middle like that, you call it a mid-sagittal plane. If it's just any old cut down the middle, you'd call it a sagittal plane, right? So here we have this one here is the mid-sagittal plane, and this one is just a regular old sagittal plane that's not classified as mid-sagittal. Here's a transverse plane. Here's another transverse plane cut through the wrist as opposed to the abdomen. Right? So those are the terms for making imaginary cuts through the human body and then looking to see what's inside. All right, now if you look in the course documents, if you look in the documents for this course, you'll see that I've given you a PDF, which is called Figure 1. And that is if we were doing this class live on the Columbia College campus, I would have photocopied this and handed it to you. But since we can't do that, I'll ask you to go and look at that. Go and look at this PDF on the student page, download it, and then take a look at it, because I'm going to go through these figures with you. And then you do need to know what these figures and what these body parts are. All right, so now let's refer to Figure 1, which is in the student portal, in your student portal in the Documents section. Okay, so these are referred to as body cavities. A cavity is a hollow spot. Right? So the body is often divided up into imaginary compartments. When we have a live human being, those compartments are not hollow. They contain organs, but we refer to the space that the organs are contained in as cavities. So there are several cavities that you need to know the names of. The cavity that contains the brain, the skull, the parts of the skull that contain the brain are referred to as the cranial cavity. And the plates, the skull is made up of several plates and other bones. The plates of the skull that actually contain the brain are referred to as the cranium. Not the cranial cavity, but the cranium. And the cranium and the skull are two different things, so don't confuse them. The skull contains the cranium, but the skull also contains other bones, like the jawbone, for instance, is called the mandible, and the upper part of your mouth, that bone is called the maxilla, but not all of those parts are encasing the brain. Just the parts of the skull that encase the brain are referred to as the cranium, or the cranial vault. You know, like a vault is like a bank vault that contains the money. We have a cranial vault that contains something much more precious than money, which is, of course, the brain. Okay, so that is the cranial cavity. Now, the spinal column the spine is made up of a bunch of bones that are referred to as vertebra, and so we call the area where the spine, all of these spinal vertebrae are contained, we refer to that as the vertebral cavity. Right? Okay, now in the front here, anterior to the spine, we have the space where the lungs are contained, right? And also the heart, right? We refer to that as the thoracic cavity. It is also known as the thorax, right? So if the cranial cavity is also known as the cranium, the thoracic cavity is also sometimes referred to as the thorax. So the thorax is the part of the body that contains the heart and the lungs. All right, now if you move downwards, inferior to the thoracic cavity, inferior to the thorax, we have the abdomen, or the abdominal cavity. The abdominal cavity contains the intestines, basically. It contains a little bit of the stomach as well as the intestines, and that is referred to as the abdomen. Right? And then inferior to the abdominal cavity, we have the pelvic cavity. If you look at the lateral view, there's where the pelvic cavity is. But if you look at the anterior view, anterior view means you're looking at the front. The pelvic cavity is here, and the pelvic cavity contains the sex organs. The pelvic cavity contains the reproductive organs. So here looking at the anterior view, we have the pelvic cavity, we have the abdomen or the abdominal cavity, we have the thorax or the thoracic cavity. Right? Now and then we have the cranial cavity. Right? Now let's divide the thorax up into some smaller parts. Right? So this area here, the upper part, which is in the center of the chest, which is in the center of the thorax, is referred to as the superior mediastinum. The mediastinum refers to the cavity in which the heart lives, and then within the superior mediastinum we have certain parts of the heart, but not the complete heart. Most of the heart is contained inside the pericardial cavity. Right? So cardial, the word cardial refers to the heart. The word peri means around, to surround, on the outside, right? So that word peri or peripheral, it refers to the word peripheral. So you've heard the word peripheral, it means sort of around the edges. Okay, so peripheral, the pericardial cavity is a cavity that surrounds the heart. And the pericardium is located within a larger area called the mediastinum. Okay, so that's the pericardial cavity. And then each lung, the lungs are located inside a membrane basically that is called the pleural membrane. And so the area that contains the lungs is referred to as the pleural cavity. Okay, but isn't the heart located in the middle of that? Well, yes. And so the heart is also located in the pleural cavity, but specifically the heart is located inside the pericardial cavity, which is located inside the pleural cavity. And all of those things together are located inside the thorax, inside the thoracic cavity. Okay, now one of the things that we're going to discuss in this course are referred to as anatomical landmarks. So you know what a geographical landmark is, right? So if you see a large mountain, that is a landmark. If you see where the mountain is relative to where you are, then you can figure out where you are. If you look around Vancouver, the tallest building that you can see is probably the Hyatt Regency Hotel that has that little rotating restaurant at the top. If you can see that, that's a landmark, then you know you're in Vancouver, and you can probably figure out where you are relative to every place else. If you're at Columbia College, if you look out of the windows on some of the fourth floor classrooms, you will see City Hall. And so if you can see Vancouver City Hall, that's another landmark. You can figure out where you are. So that is referred to as a landmark. A landmark is used to figure out where you are and where other things might be. So in anatomy, we're going to learn the names of a few anatomical landmarks, which are areas of the body that are used to, if you can find this landmarks are things that are easy to find on the outside of the body, or easy to, if they're on the inside of the body, they're easy to find. And then from the parts that are easy to find, you can figure out where the other parts are. So those are referred to as anatomical landmarks. Now, one of the anatomical landmarks that we're going to learn about is the diaphragm. The diaphragm. The diaphragm is the anatomical landmark that physically divides the thorax from the abdomen. Right? So the dividing line, the official dividing line between the thorax and the abdomen is the diaphragm. And the diaphragm, some of you may know, is used to help breathe. It's used to help your breathing. Right? So it helps to pull the lungs downwards, and then that process of pulling the lungs downwards increases their area on the inside and sucks air inside. So the diaphragm is not only it's a muscle that's critical for breathing, but it's also an anatomical landmark that is supposed to be the official border or the official dividing line between the thorax and the abdomen. Right? So the diaphragm is one example of an anatomical landmark. All right, now if you continue to look at that figure, you'll notice that the different parts of the body have different names, different areas. Okay, so the cephalon refers to the head. Right? The cranium refers to a specific part of the head. The term axilla refers to the armpit, the axillary region. The term brachium refers to the upper arm. Right, just above the elbow, the upper arm, that's the brachium. The carpus, what do you think that means? Ever heard of the term carpe diem? Carpe diem was a famous phrase in Latin, which means to seize the day. It was means to seize the day, but it's a bad that's a bad English translation, because carpe means to grab with your fist. It means to grab it and make a fist, grab hold of something by making a fist with your wrist. And so the term carpus refers to the wrist. You've probably also heard the term carpal tunnel syndrome. There's a structure located at your wrist that is referred to as the carpal tunnel, and if it becomes inflamed, it pinches some of the nerves that run through the carpus, that run through the carpal tunnel and cause pain. So that's carpal tunnel syndrome. So the term carpus refers to the wrist. You already know what the term thorax means. The thorax, this is the thorax, this area. You know what the abdomen is. It's this general area. The umbilicus is where you find the umbilical cord when a baby comes out of the womb. That's what we commonly call the belly button. That used to contain an umbilical cord that the baby used to breathe while the baby was in their mother's womb. All right, the femur. The femur is a bone located in the upper leg. Right. This area, the groin, is known as the inguinum, or the groinal area, also known as the pubis, this area just above it. The kneecap is referred to as the patella, so this is referred to as the patellar region. The shin, the front part of your leg, is referred to as the crus, and the tarsus is the ankle. Right? The tarsus refers to the ankle. Now, notice here on this diagram, which is in your handout, the pollex refers to the thumb, right? The pollex. The forearm, this area of the forearm, is referred to as the antebrachium. So the pollex means the thumb, right? The big toe, which is the foot's equivalent of the thumb, is referred to as the hallux, the hallux. Okay, and so the femur area of the leg refers to the front part of the upper leg. Okay, so you do need to know what all of those areas are. By the way, the area inside your cheeks is the area where your cheeks are is referred to as the buccal area. Buccal area. The area where your ear is referred to as the oris, A-U, not O-R. The area where your nose is refers to as the nasus. The neck is the area where your neck is referred to as the cervicis. Cervicis means a narrow area, and your neck is quite narrow compared to the rest of your body, so that's what that means. Right? The oris, O-R-I-S, instead of A-U-R-I-S. Oris, O-R-I-S, refers to the mouth, of course. So when we give this course in real life, when we're actually back at the campus, usually it's my practice at the end of the year to give the students an oral exam on anatomy. So I test each student individually for about 10 minutes to see if they know the names of the body parts, and we call that an oral exam. But does oral refer to the mouth or to the ear? In this case, I don't know. I don't know. I usually call it an oral exam, but technically with an O. But technically, if you say oral exam, O-R-A-L, you're referring to like a dentist looking in your mouth. Whereas an oral exam means an exam that you hear me asking the questions. So technically, it should be oral, A-U-R-A-L, oral exam. Okay, now if you look just at the abdominal area and the pelvis as well, it's common practice for anatomy people and medical people to divide it into 4 parts, which are called quadrants. The word quad is of course the Latin word for 4. So quadrant, whenever you divide something into quadrants, you're dividing it into 4. So this picture is again in your diagram, that the handout, right? And so medical people often refer to these areas as the 4 quadrants, right? And so here we have the left upper quadrant, the right upper quadrant, the right lower quadrant, and the left lower quadrant. Right, so if somebody might say, I have pain over here, and then the doctor or the nurse practitioner will write down pain in the left lower quadrant. So that's the technical term for those parts of the abdomen. Some of the interesting things that are located here, notice this structure back here is the liver. Right, so the liver is located mostly in the right upper quadrant of your body. Notice that the liver extends down below the ribs. So if you feel, you can feel the ribs quite easily on the right side of your body. If you kind of feel just below the ribs, you'll be feeling your liver, and then you'll be able to feel where the liver ends, sort of, because there's a spot where the liver ends and the intestine begins, and usually you can kind of feel the transition. So you can definitely feel the bottom of your ribs, and then if you feel down a little bit farther, you can feel a kind of a crease where the liver ends and the intestines begin. All right, some people, because we like to have more detail, divide the abdominopelvic region into 9 regions instead of 4. Okay, now the very central of the 9, the very central one is referred to as the umbilical region, because that's where the umbilicus was. That's where the umbilical cord was. Okay, the word epi means above. Gastric refers to the stomach, so this quadrant here is referred to as the epigastric region because it is literally located above the stomach. Now, the left hypochondriac region is located above and to the left of the stomach. The right hypochondriac region is located on the right side above and to the right of the stomach. And then we have this area that's sort of located between your ribs and your pelvis is sometimes referred to as the lumbar region. For example, the vertebra, the backbone parts that are in your lower back are referred to as the lumbar vertebra. So this area is if you looked on the anatomical diagram that I showed you, that if you looked at the rear picture with the posterior view of the figure, you'd see that that area of the back is referred to as the lumbus. And so we have the right and left lumbar region, and then we have the right and left iliac region. So iliac refers to this bone here, which is called the ilium rather, sorry. So the left and right iliac regions refer to the hips, kind of basically where you find the left and right hip bones are the left and right iliac regions. And then of course the area below the stomach in the center is referred to as the hypogastric region. So sometimes the word, to indicate that something is superior to something else, you say the word hyper, H-Y-P-E-R, and if it's below, inferior, you can say hypo, H-Y-P-O. So if the stomach is located at a certain level, you can refer to the level above it as the epigastric region. So epigastric literally means above the stomach. Hypogastric literally means below the stomach. But the people who named these parts of the abdomen kind of mixed up their terminology because, they should at least have the terms match. So if you're going to call the area below the stomach the hypogastric region, you should have named the area above the stomach as the hypergastric region, but they didn't do that. They kind of mixed their terms up, but I didn't do it. I'm just explaining to you what it's called. All right, now just for fun, if any of you are interested in becoming a nurse or a doctor or a care aide, you can become a care aide with a training course at VCC that lasts about 4 weeks, and then you deal with you do basically the dirty work of handling sick people in the hospital or nursing homes. You can become a nurse in 2 years. You can become what's known as a licensed practical nurse in 2 years, and you can become a registered nurse in 4 years. Or if you're interested in being a doctor, that would take anywhere from 8 to 15 years because doctors spend a ridiculous amount of time in school, in university, and then they spend a ridiculous amount of time doing what's known as a residency, where they spend even more time working. Basically, a residency is an apprenticeship where you're an apprentice doctor that has to work for years before you actually are qualified as a specialist. So for example, if you want to become a doctor, you spend 4 years in university because and get a bachelor's degree, because most medical schools want you to have a bachelor's degree before you enter medical school. So you spend 4 years as an undergraduate, you get a bachelor's degree. Then you spend 4 years in medical school, you get an MD, but you're not done yet. So that's 8 years, but you're still not done. Then you have to spend a certain number of years doing a residency, and the shortest residency you can do is a general practitioner, which I believe is 1 year. So you spend 1 year working in a hospital as an apprentice, basically, and then you're a GP, you're a general practitioner. If you want to be a surgeon, the residency period for a surgeon is about 7 years. So if you put together the 4 years for the bachelor's degree, the 4 years for the MD, and the 7 years for the residency, you can see that that's 15 years of your life that you have to devote to being a student, basically, before you can actually start practicing your trade. So if you like medicine, you could become a doctor, but I don't know if it's worth it necessarily, because there are lots of other professions you can do where you get to work with people, and you get to work with medicine, you get to work with other things that are nice and fascinating and interesting about medicine, but you don't have to go through all that much training to do them. For example, as I said, you can become a licensed practical nurse in 2 years. You can become a registered nurse in 4. There are other specialties that are referred to as allied health professions. You can become an electrocardiogram technician in a couple of years. You can become something called a perfusion technician, who assists in the operating room in about 2 years. So these are all other professions that you can do without having to go through all of the expense and time necessary to become a doctor. So if you're interested in medicine or any of those fields, here's some interesting things that you might want to learn about. If you're handling patients, the different positions that you put a patient into a bed are given different names. So let's look at those. Okay, the Trendelenburg position is where you put the patient on their back with their feet elevated above the head, preferably, right? So this is for people who have one of two problems. One is they may have circulatory problems with the blood. So the blood is not circulating very well. If you stand up or you sit up all day, the blood, because it doesn't circulate very well, it tends to end up in the feet. So the blood accumulates in the feet. So then you put a patient with this problem into a bed, and you elevate the feet above the head, so the blood has a chance to come back. So the blood has a chance to come out of the feet and head back up to the heart, and maybe even to the head. The other problem is if somebody has a lot of mucus in their lungs. You know what mucus is, because that's the sticky liquid that comes out of your nose when you have a cold. There are lots of places in your body that produce mucus. And so if you have a lot of mucus in your lungs, you have to cough it up. It's often easier to cough up the mucus and get rid of it if you're lying down, and it's even easier if you're lying with your head below your feet. So your body is at an incline, so your lungs are lower than your feet and your head is lower than your feet. And when you cough up the mucus to clear the mucus out of your lungs, that's literally called clearing the lungs, right? So you cough up phlegm or mucus from the lungs, and that's called clearing. Right? So some people have difficulty doing that if they're standing up. It's easier for them if they're lying down. It's easier for them sometimes if you turn them on their stomach. It's easier if you elevate the feet so that the lungs are below the feet sometimes, right? So that's the Trendelenburg position. The purpose is you put the patient face up in the bed, and then you elevate their feet so that they're above the head. And then the purpose of that is for venous return, getting blood back to other parts of the body and away from the feet, or to make clearing the lungs easier. All right, now 2 words that you need to know. Prone means face down, and supine means face up. These positions apply not just to patients, but to parts of the body. So for instance, if you put your arm out and you turn your hand face up, that is if you have your hand facing down, so the palm is facing the ground, and you turn your hand so that the palm is facing upwards, that is called supination. Supination, to turn the palm of your hand or the face of your hand up. So face up, supine, or supination. So supine describes a position, and supination describes a movement. Okay, pronation, if you have your hand out with the palm facing up and you turn it over so it's facing down, that's called pronation. Right? So pronation means to turn upside down. And the prone position of a patient in a bed means they're in the bed face down. Right? So we have the prone position where you have a patient face down in a bed, and the supine position is where you have a patient flat in a bed but face up. Okay, now Fowler's position, interesting most of all, is where you kind of position a hospital bed. You know, hospital beds are nice because you can elevate the back independently of elevating the knees, right? So you've probably seen that happen in the hospital. You can elevate somebody's knees and you can elevate their back, so they're kind of sitting like they're sitting in an easy chair. You know, those easy chairs where you have a footrest that comes out, or you use an ottoman stool to put your feet on. If you organize the bed so it's in that position, that's referred to as Fowler's position. Most people find that more comfortable than lying flat, and a lot of people find it easier to breathe in that position than if you're lying completely flat. Whether you're face down or face up, breathing may be easier if you are face up in Fowler's position. Okay, so here they all are, right? This is Trendelenburg position. The patient is laying in a supine position with the feet above the head. The head is lowered, the feet are elevated. Prone position means the patient is laying flat but face down. Supine position means the patient is laying flat but face up. And Fowler's position, you're kind of sitting in this position with the knees elevated and the back elevated 45 degrees, because many people find it easier to breathe in that position. Right? So memorize those 4 positions. You might get those on one of the first tests. You might get those on the midterm or something like that, or the other tests. All right, now as promised, let's just have some fun with medical root words. The root words that are used to make medical terms, they were all put together during the Renaissance. They are derived from Greek and Latin root words. And when I say Greek, I don't mean modern Greek, because you may have friends who speak Greek and they won't understand what any of these words mean, because these words are actually words that the ancient Greeks spoke. So Plato and Aristotle and Hippocrates and all these people spoke ancient Greek, and that's where some of these words come from. All right, here's some fun words. The term angie or angio refers to blood vessels. The term arthur or arthro refers to joints. Right, so you know that those insects and various other animals that have bendable legs are referred to, they belong to a phylum, they belong to a group called the arthropods. Right? So an arthropod refers to insects and arachnids like spiders and ticks and other things of that nature, crustaceans, lobsters and crabs, that have jointed legs. So the fact that their legs have joints, whereas many other animals don't, the fact that they have these jointed legs, we call them arthropods. The word pod means foot. The word arthro means joint. So the word arthropod literally means jointed foot. Okay, so the word arthro in medicine refers to joints. The word cardi refers to heart, cardi or cardio. The word cyan is the Latin word for blue. The word, I believe it's a Greek word, not that it matters, but I believe it's the Greek word for blue. The Greek word for arith or erythro means red. Right? Erythro. Arith meaning red. The Greek word leuko means white. The word hepat is a word that's used to refer to the liver. The prefix nephra or nephro refers to the kidney. The word osti or osteo refers to the bone, and the word rhine or rhino refers to the nose. Rhino, of course, is easy to memorize because you just think of a rhinoceros. More words. The word hyper means either too much or above. The word peri means around, as in periphery or peripheral. The word endo means inside. The word algia means pain. The word site, this is actually a suffix, so you put this together on the end of a word. It means cell. Right? So site is a word for cell. The word ectomy, again is a suffix, means surgical removal of something. Okay, this is an interesting one. This is one of my favorites. The suffix itis means inflammation. Right? So if you want, you know what inflammation is. That's when a body part becomes irritated and it swells up and it turns red and it hurts and it feels hot. That's called inflammation. Inflammation. And the way you describe inflammation is you take the name of the body part and then you add the term itis to the end, and that tells you which body part is inflamed. That's all it means. Okay, so the suffix otomy means to cut into. The word plasty means surgical repair of something. Plasty means surgical repair. The word penia means decrease or lack of something. The word Brady means too slow, slow or too slow. The word tacky means fast or too fast. And the word megaly means too big, big or enlarged or too big. All right, let's put some of these parts of words together, some of these root words together, and then see if we can figure out what the actual medical phrase means. So now we're learning medical jargon. We're learning the language of medicine and as well as anatomy. You tell me what the word means. Okay, the word erythrocyte. What does it mean? Okay, you can pause the video if you want to try and guess, and otherwise I'll tell you. Erythrocyte means a red blood cell. Technical term for a red blood cell is an erythrocyte. Okay, what about a leukocyte? The answer, leuko, white, cyte, cell. It means a white blood cell, a leukocyte. Technical term for a white blood cell is a leukocyte. Leukopenia, what do you think it means? Leukopenia means a decrease or an absence of white blood cells. So there are some people who have various diseases, immunodeficiency diseases, where their immune system is compromised and they don't have as many white blood cells as they're supposed to have. You call that condition leukopenia. Leukopenia. All right, what does the term anemia mean? You won't be able to figure it out from the chart here, from the words, but can you guess? The word anemia specifically refers to a lack of erythrocytes. It refers to a lack of red blood cells only, right? So the word anemia means specifically means a lack of red blood cells. Leukopenia means a lack of white blood cells. Anemia means a lack of red blood cells. What do you think bradycardia refers to? Right, so bradia means too slow, and cardia refers to the heart. So the term bradycardia refers to a heart rate that's too slow, a slow pulse. Right, so typically, it depends, but you know, a pulse of around 25 or 30 would be considered bradycardia. What about tachycardia? Okay, so that of course means a heart rate that's too fast. So tachycardia typically is defined as something like if you have a pulse that's faster than 250 beats per minute, that's definitely tachycardia. Heart rate that's faster than 200, something like that, would probably be tachycardia. What does angioplasty mean? All right, so plasty refers to surgical repair, and angio refers to blood vessels, and so angioplasty is the surgical repair of blood vessels. What do you think hepatitis means? Hepatitis, hepa or hepato refers to the liver, and itis refers to inflammation. So hepatitis is inflammation of the liver. The liver swells up and becomes irritated for whatever reason. Hepatitis. Rhinoplasty. Okay, so again, plasty means surgical repair. Rhino means the nose. So this is the technical term for a nose job, when somebody has their nose surgically changed. Arthritis. Okay, so arthro refers to the joints, and itis again means inflamed. So arthritis means inflamed joints. So you've probably seen people with arthritis, their joints, if you see their hands, for instance, somebody has arthritis in their hands, the knuckles and the other joints of the hand are swollen up because they're inflamed. And we'll talk about that later, but arthritis means inflammation of the joints. What is a hepatocyte? Okay, so the word cyte means cell, and hepato refers to the liver. So hepatocyte is the technical term for a liver cell. Erythrocyte is the technical term for a red blood cell. Leukocyte is the technical term for a white blood cell. What is an osteocyte? Okay, so again, cyte means cell, and osteo means bone. So this refers to bone cells. You may not think of bones as having cells, but they do. So bones have the bone tissue is actually built by cells that are called osteocytes. In fact, they're specifically built by a type of cell called an osteoblast, which we'll talk about later. There are two types of bone cells. An osteoblast is a bone cell that builds bone, and an osteoclast is a bone cell that takes bone apart, specifically to release, for the purpose of releasing calcium into the blood. That's why you would want to take bone apart, because bone is not only there to give our body strength, but it is also there as a storehouse for calcium. Okay, so the general term for bone cell is osteocyte. If the osteocyte is specialized to build bone, you call it an osteoblast. If it's specialized to take bone apart, you call it an osteoclast. What do you think hepatomegaly means? Okay, megaly means too big or enlargement, and hepato refers to the liver. So this means hepatomegaly means an enlarged liver, which you would probably get if you had hepatitis, right? So if you have hepatitis, the liver tends to swell up and get bigger, and so you end up having hepatomegaly. Cardiomegaly? Okay, so of course that means an enlarged heart. If there's something wrong with your heart muscles so that the heart muscle is building up to, sometimes people have various heart problems where the heart muscles are weak and the heart tries to compensate for the weak muscles by building bigger muscles. The heart ends up becoming enlarged. They call that cardiomegaly. That's a sign that the heart is failing, basically, and so you need a heart transplant or you need something else to fix the problem. But an enlarged heart is not a good sign. It's a bad thing. So cardiomegaly means that the heart is enlarged for whatever reason. Okay, what do you think? You've heard of brain surgery called lobotomy. What does otomy mean? It means cutting into. Okay, so the brain is organized into different parts called lobes. So a lobotomy is where you cut a piece, you either cut away or you cut into one of those lobes. So one of the lobes that the brain is made up of is referred to as the frontal lobe. So a frontal lobotomy is where they cut into the frontal lobe. Generally that kind of turns you into a vegetable, if I can put it that way. It makes you it kind of puts you into a daze for the rest of your life. It used to be used with serious mental conditions that they didn't know any other way to deal with it. They used to give somebody a frontal lobotomy basically just to calm them down and make them easier to manage. But that's irreversible, and it's also a little bit barbaric. Today we tend to think of that as being kind of a barbaric form of therapy, which it is. And we tend to, mental patients who are highly disturbed or have extreme behavior problems and things like that, instead of cutting up their brain, we have now discovered drugs that control their bad behaviors better than lobotomy does. But lobotomy refers to cutting into the brain. All right, okay, what do you think the periosteum is? What does peri mean? Okay, peri means around, and then what does osteo refer to? Bone. Okay, so the periosteum is the name for a membrane that surrounds the bone on the outside, around the periphery of the bone. All right, what do you think endosteum means? Okay, so some of the longer bones, like the long bone in your leg, that's called the femur, or the long bone in your arm, that's called the humerus. The long bones have a hollow compartment on the inside that is filled with yellow bone marrow, and that hollow part is called the medulla of the bone. Generally, if you have an organ, the central part of the organ is called the medulla, and the outer part of the organ is referred to as the cortex. Right? So the long bones, the humerus and the femur, have a hollow compartment that has a membrane surrounding that compartment, which is referred to as the endosteum. So the endosteum is a membrane that surrounds the hollow medulla on the inside of some of the bones in the body, right? So we have the periosteum. All bones have a periosteum because they all have an outside. And then many of the bones in the body have an endosteum as well that's surrounding a hollow compartment on the inside. All right, so what did we talk about in this lecture? We talked about how life is organized all the way from atoms to molecules to macromolecules to organelles to cells, and then you put together a bunch of cells that are all the same. You have tissues. That's referred to as histology, is the study of tissues. Then we put together a lot of tissues into functional organs, and if you put together all the organs that carry out the same type of a job for the body, that's called an organ system. And we are going to learn biology. We're going to learn anatomy and physiology using systems biology. We're going to use the systems method of learning about anatomy and physiology. Okay, you learned about what homeostasis is and what positive and negative feedback are, what a stimulus is, what homeostasis is, and what positive and negative feedback are. We had learned about anatomical terminology, and then we had some fun with medical root words. Let's see if we learned any of this stuff. Okay, anatomical directions. Question 1, the ear is what to the nose? How would you describe the position of the ear relative to the nose? Okay. How would you describe the position of the nose relative to the ear? Remember that the nose is located in the center of your face, in the midline, in a mid-sagittal position. And then is the ear located to the side or closer to the center? Okay, think about that. Is the nose located, closer to the center or farther away from the center than the ear, and vice versa? Okay, now the nose is located above the mouth, so what would you say? How would you describe the position of the nose relative to the mouth? And how would you describe the position of the mouth relative to the nose, given that the mouth is below the nose and the nose is above the mouth? How would you describe the position of the heart relative to the spine, bearing in mind that the heart is located near the front part of the body and the spine is located near the back part of the body? And how would you describe the position of the spine relative to the heart? Okay, how would you describe the position of the hand relative to the position of the elbow, and considering their position to the trunk? Are they farther away from the trunk or closer to the trunk? And how do you describe a body part being on, a part of the arm or a part of the leg that's farther from the trunk or closer to the trunk, to the torso, also known as the trunk? Okay, what about, so the hand's position to the elbow is one thing. What about the elbow's position to the hand? How would you describe that? Okay, now how about this? The elbow is something to the shoulder and also something to the hand. Okay, so what is the position of the elbow relative to the shoulder as well as relative to the hand? That's a good question. Okay, and then in anatomical position, how would you describe the position of the thumb relative to the index finger? Right, is it farther to the side or closer to the center? Remember which way the thumb is pointing when somebody is standing in anatomical position. Whenever we describe a part of the body or a location of a part of the body, we always assume that the person is standing in anatomical position, even when they're not. Okay, you ready for the answers? All right, so the ear is lateral to the nose because the nose is located in the center of the face and the ear is located off to the side. So therefore the ear is located lateral to the nose. And then the nose, if you're describing that, the nose is located medial to the ear because it's located right in the center. So the ear is off to the side. You would say the nose is medial to the ear, or the ear is lateral to the nose. Okay, above and below, the nose is actually above the mouth, so we say the nose is superior to the mouth and the mouth is inferior to the nose. The heart is located on the anterior side of the body. The spine is located on the posterior part. So we would say the heart is anterior to the spine, and the spine is posterior to the heart because it's closer to the back side of the body than the front side of the body. The hand is distal to the elbow because it is farther away from the torso than the elbow. The elbow is proximal to the hand because the elbow is located closer to the torso than the hand is. So we say, if you say the elbow is proximal to the hand, that kind of gives the impression that the elbow is located close to the hand, but we're not actually talking about how close the elbow is to the hand. We're talking about how close the elbow is to the torso. Okay, then this is a good question. The elbow is distal to the shoulder but proximal to the hand. Right? It's because the elbow is farther away from the torso than the shoulder, but it's also closer to the torso than the hand. So we say that the elbow is distal to the shoulder and proximal to the hand. Okay, when someone is standing in anatomical position, and we always assume that they are when we're talking about body parts, remember that the thumbs are pointing outward, which means that the thumb is lateral to the index finger. So the thumb is farther away from the mid-sagittal position of the body than the index finger. Okay, very good. So you've gotten through that lecture. Now proceed, whenever you're ready, proceed on to Unit 2. And I apologize, we have to learn some elementary chemistry, but it'll be over with. I think probably a lot of you know it already, but it's my job to make sure that everybody knows a certain amount of chemistry before we can embark on a more detailed tour of the body. So go on to lecture number 2 and learn a little bit of chemistry.